Welcome to our all right, I got it. Thank you. As Joanne very nicely introduced us, I'm Casey Cowie, the Chief Medical Officer and a family physician at the Summit Community Care Clinic. I also work part-time at Swan Mountain Women's Center. So if you see my picture in the paper for there, don't be confused. I work in two places. And then I'm also pursuing a health coaching certification. So hence this program. And then you're going to meet Lilly and Kristen. I'll let you kind of introduce themselves as they have their parts in the presentation. So part of what we really wanted to spend some time on today is talking about nutrition at any age. And you might look at us and say, what do these girls know about nutrition in your 60s or above? And we'll just say, you're the experts, we're not. And that's the thing with health coaching, is that we really have our patients and clients kind of drive, and we are there to support. And so we'll kind of talk about what does that mean as we go. So
I want to ask Bill, can you hear okay, Bill?
No.
perfect, good.
Thank you.
Okay.
So Lily, go ahead and introduce yourself and what do you do?
Yeah, so my name is Lilly and I'm a certified,
You stand up.
is it better up here? Here, I'll come this way.
We have this right on the lectern here. And that helps.
Perfect.
If you talk into that, it helps.
And is this better if I stand here?
No?
Right here?
Yes.
Perfect. We found the sweet spot. So like I said, my name is Lilly and I am a certified health coach that works for the clinic. I have a background in personal training, as well as I am currently pursuing a holistic nutritionist certification. I am currently the integrated care manager now at the clinic. I'm still doing some health coachings because I love it. But also kind of training up some new individuals so they can kind of take the reins.
Yeah, and I'm Kristen Griffin. I'm a behavioral health provider over at the Summit Community Care Clinic. So I'm an individual therapist. I see folks with substance use disorders. I treat anxiety, depression, a whole host of things, or people just facing some mental health challenges in their life. And I have just a special interest in how nutrition and diet, exercise, all of that impacts someone's mental health. So I joined Dr. Cowie and Lilly this year to offer some group health coaching and kind of have a different perspective on it coming from the mental health realm.
Thank you. So a little bit of background about the Summit Community Care Clinic. Hopefully you're really familiar with our organization, but if you're not, we're a community health center. We're just right up the road. And we see patients of all ages, from in the womb until end of life. And so the whole spectrum of folks. We have family physicians and we have an integrated care model, which Lilly mentioned. Her title is an integrated care manager. The idea is that we really take care of folks holistically. So that means your medical, dental, and behavioral health needs all in one place. We have a full dental clinic, medical clinic, and behavioral health staff. We also staff 6 school-based health clinics, 4 in Summit County and 1 in Lake and 1 in Park County. So we're busy and we're growing and we're big. So one of the things that we really identified is that we wanted to grow more within the clinic is our health coaching program. So what does that mean? So a health coach is someone who does exactly that, coaches someone to better health. And so that can mean a lot of different things. So if your goal as an individual is to lose weight, it could be around those goals. If your goal as an individual is to have better relationships, it can be around that goal. So it can be individualized. As you can imagine, a lot of what we do is around nutrition. And so a lot of things we're going to talk about is around nutrition. And so the difference between a health coach and a registered dietitian, a registered dietitian goes to school, to college, to get a degree in dietetics, and then is able to basically give a prescription to someone to how they should eat based on a medical condition. So if someone has diabetes, they'll prescribe a certain kind of diet. If they have celiac disease, they'll prescribe a certain kind of diet. So a health coach doesn't necessarily prescribe diets, but basically we'll come up with an individualized approach that will help you achieve your health goals. So it's a little different, and the training is different. A nutritionist is a broad term that includes dietitians and health coaches. So if you see nutritionist, you want to ask, what does that actually mean? A therapist can also have a broad definition as well. So they used to call health coaches health therapists, but that got confusing. And so, yeah, therapists typically, as you know, will be someone like Kristen with a degree in either social work, counseling, or something along those lines. That focuses more on mental health, but as you can see, there's a lot of overlap. So what is really cool is to work in an integrated team of medical, health coaching, and behavioral health all in one, which is just really cool. So that's what we do. So what would be the benefit of health coaching for seniors specifically? So there's a lot of different needs in nutrition and in diet as we grow up and as we age. And there's a lot of life changes that happen too. So we're going to talk a little bit about what nutrition is in a more holistic sense. So what we call primary food versus secondary food. And so I'm going to go ahead and let Kristen take it away from here.
Thanks, Dr. Cowie. Yeah, so as Dr. Cowie mentioned, there's this idea of what fuels our bodies. It goes beyond just what we put in our mouths, right? Food. That there's this idea that primary food are other things that we do day to day or in our lives that also fuel our bodies and feeds our bodies. These can be things that we're doing that are intellectually stimulating. These can be physical things that fuel us, right? Exercise, hiking outside, enjoying Summit County, creative sources of fuel for us. And so today we wanted to talk about primary food and secondary food. We'll talk about the actual things that we put in our mouths and how that can support health. But primary food is really important to talk about too. Because when different sources of primary food aren't there, or maybe our primary food sources are kind of out of balance, we tend to seek out maybe secondary food to fill some of those voids in our lives, and lacking some sources of primary food can also lead us to some uncomfortable emotional states. We can experience maybe loneliness or stress if some of these sources of primary food are going unaddressed. So secondary food, which I said we'll get to more specifics on what we would encourage or recommend people eating and putting in their bodies, but we wanted to spend some time on primary food, right? So these different outlets in our lives that also fuel our bodies. So to do that, we have an activity. Hopefully everyone got the activity as they walked into the room. Is anyone missing that piece of paper, the circle of life? Everyone's got a copy? So what we're going to do is we're just going to take a moment to reflect on your different sources of primary food in your life using the circle of life activity. So there's 12 different slices of pie on your sheet in front of you. And Zoom people, hopefully you can see the circle of life too on your screen. If you have a piece of paper and pen with you, you can kind of reflect on this as well. But what we're going to ask you to do is kind of rank or rate how satisfied or fulfilled you feel in your life in all of these different areas. So if the center of the circle was maybe 0%, oh gosh, I could use my shadow. If that was like 0%, right? And on the outside of the circle is 100. Going around the whole pie, just kind of ask yourself, how fulfilled or how satisfied am I in this area of my life, right? How are my relationships going? Am I feeling 100% fulfilled and satisfied with relationships I have in my life? Or maybe I'm feeling like that area of my life needs a little bit more attention. Maybe you're more in the middle. So you're going to go around all of these different slices of pie and just put a dot where you would rate yourself in those different areas. And we'll talk about kind of reflections and insights gained.
Center is 0.
Center is 0 and outside is 100. Mm-hmm. All right. Yeah.
I'm over here.
No, we read that.
Oh, interesting. Yeah, we talked about doing that.
Yes.
Does anyone have any questions about what to do with the activity?
That was the pointer,
Yeah.
your laser pointer.
Lily showed me how to circle things on a PDF. We're stepping up the game.
Okay, so if you were totally perfect, it would be a circle if you connected all the dots.
Mhm.
You got a circle.
Nobody's
You don't have a
there.
circle at all.
No one's got a perfect circle.
I might get a circle a lot lower.
That's true.
I'm trying to think.
Yeah.
I'm laughing about the whole thing.
Oh.
I see some giggling back there,
Has been a lot of
maybe you're happy with that area of your life then.
Yeah.
You know,
So then they-
Okay. Would anyone like to share anything about their circle of life? Anything that was kind of eye-opening? Anything that they kind of are thinking about as they're looking at their circle?
What happens if you're more shifted towards one side than the other? Does it get sorted out? Is that important or no?
Not specifically, but it just shows some areas of imbalance. And so in a health coaching session, that's often we'll spend time on one of these each time to talk about, okay, where you're doing really great in this area. So is it taking away energy from another area? Or if we put more energy into this area, would it help everything improve? You know, so there's a lot of things, we use it as a tool to kind of help focus our energies.
Yeah, like Dr. Cowie's saying, right, that this is a really good tool to just kind of evaluate, hey, how are different areas of my life going, right? It's feedback. If I'm feeling like, hey, my relationships, I'm not feeling 100% satisfied with that right now. That's good feedback. That's good information to say, what do I need to do if that's important to me, right? To maybe give more attention and time and energy to that primary food source in my life. Did anyone want to share anything about their circles or areas that they were surprised by when they rated them? Yeah.
Career. I don't want a career.
Yeah. Maybe you're very satisfied with that, right? So it's more your degree of satisfaction with it, right?
So that's even higher versus lower.
Right.
Yes.
Absolutely.
Yeah. Yeah.
Yeah. Yeah. And that brings me to another really good point, right? That this circle of life changes with different stages of life that we're in month to month, depending on what's going on. And so it can be a good tool just to kind of reevaluate, right? Where am I at and how am I doing in these different primary food sources in my life? And something else that we wanted to talk about, right? Again, why primary? Oh, I'm sorry. Yeah.
Yes, I did notice something. I'm doing better than I thought.
Yeah, that's great. Yeah. Yeah. And so just to reiterate, right, why primary food is important. Because when we do have a balance, when we are feeling fulfilled by different areas of our life, we tend to overall have a better sense of well-being, right? And imbalances in different areas of our primary food sources can lead to unpleasant emotional states, more stress, feelings of isolation. And so it's good just to be aware of, right? Where am I at and how am I doing in these different areas of my life? And so that's what we wanted to encourage or invite you all to do today, was just kind of assess, right? How am I doing with my primary food before we get to the secondary food portion? And to your point, right, that this changes based on kind of stages of life and where we're at. And sometimes coping with changes in our circle of life can be difficult, right? Maybe we don't have a career anymore, or maybe my physical primary source or primary food source was really something that I got a lot of fulfillment of in the past, and I'm not able to do some of those things that I used to be able to do. And so it's good to evaluate, you know, where else can I find that satisfaction or that fulfillment? What other things do I need to help myself cope with changes in my circle of life and still feel really fulfilled? So thank you all for participating in that. Does anyone have any questions or kind of final reflections with this activity?
I think I'm more focused on what I was not to my satisfaction than I was. That's what I was surprised with. There were all these areas that were really good, and I didn't think about how good they were.
Right.
I was kind of focused on the stuff that was troublesome.
Sometimes that alone is really therapeutic, right? Being like, I'm actually doing pretty good, right? So how can I keep that up? Where did that come from, right? So, yeah.
I have one question. You might repeat it for the Zoomers.
Sure.
So they can hear.
Mhm.
I was interested to see home cooking.
Yeah.
Here.
Yeah.
Can you explain that?
Sure. Do you want to do it? You want me to?
Yeah, I mean, from my perspective, you know, everyone can have their own perspective on the different categories that are here. But a lot of people can find home cooking as a way to decompress, as a way from getting home from a busy day, whatever that entails, going home, chopping something, sauteing something, baking something, can be really, you know, mindful for some individuals. Now, on the other spectrum, that can be really stressful for other people, where someone does not want to do that at all. I am more on the side of I love cooking. Cooking is my way to be creative in my day, take time for myself. All of those things we're kind of talking about in this circle. And so if that's something that you are like, absolutely not, I do not cook, I do not want to cook, you know, by not doing that means you're fulfilling what you want with your desires and your balance in your life too.
However, I'm gonna jot in there is that the other reason that it's in there is that often if we're prioritizing home cooking, it's driving our secondary food choices, secondary food being what we put in our bodies, right? And so if we're eating out a lot, not preparing our meals a priority, then often we're not getting the balance of vitamins, nutrients, macronutrients, things that we need to really feel our best. And so that's why it is really important that it's actually its own slice in that sort of life.
Thank you.
Sure. Yeah. I think you're up, Lily.
Fantastic. So I'm going to kind of start off the secondary food section here. So I'm kind of talking about a lot of the big foods. So why is it important to, you know, eat the rainbow of vegetables, right? We hear that all the time. Different colors, different textures, as many different kinds of vegetables as we can get in. You know, also noting that these are general recommendations. Some vegetables may not be great for everyone. So understanding that the reason why we really want to be eating, I love to say the rainbow of colors, is because they have different minerals, they have different vitamins that are really crucial for our body and supporting our body's health. I also put up here that, it helps with the prevention of all diseases. Minerals and vitamins, whoo, man, they really get mixed up in my head there, can be so wonderful because they help support your body in fighting different diseases as well. And I was hearing at one place that, the more colors you get in, the more anti-aging you get from the different vegetables too. So I thought I'd put that in there. Another really important food group is eating antioxidant foods. The more oxidation you have in your body and your cells can lead to more inflammation, and we want less inflammation in our bodies. So being really mindful of how we're eating things, what we're eating, because some of that stuff can lead to inflammation. And so we really want to focus on those antioxidant foods. So some examples of where it can come from. Bone broth is an excellent source. Eating animal skin, like the skin on a chicken, as well as animal proteins, because they have really important amino acids in them that can be vital to your health, as well as reducing the oxidative stress. So those are kind of some big points that I like to touch on for general recommendations for each individual that I talk to. Yeah.
Animal skin is no.
Isn't that confusing?
Yeah.
Yeah. I mean, a lot of times people say that, it has fat in it, so I want to stay away from that fat for my health. Now, as a general recommendation, if you're trying to stay away from animal skin, maybe that's not the source for you. Maybe a bone broth is a better source. So always being mindful of yourself and your own health and being an advocate for yourself is the best way to really hone in on your nutrition as well as your health. I saw a question.
I was referring to say because I cannot eat the skin of chicken.
Yeah.
So where are we?
Definitely.
A little bit of fat.
I, say, as like I said before, whatever is most important to your health, that's supporting, your health is really kind of where you want to be guided. So if the source of the skin or the fat is not where you want to be in consuming, maybe it's the bone broth. Maybe it's a protein, but a leaner protein. As long as you're getting in those kinds of animal proteins, those are the best sources of those amino acids that you're really looking for. Now, you can get them from combinations of different vegetarian foods. A very common one is like a rice and beans. You can get amino acids from a combination of rice and beans, but it may not be as pure of a source as if you were eating animal proteins. Does that make sense?
What can you possibly do with bone broth that makes it edible?
I think that's a personal endeavor there.
I don't know if I see eat it, but I'll tell you what.
Does anyone have suggestions for
I personally like it, so I think it's acquired taste. I think the point that Lily is trying to make is that this are places you can find these things. Some of them may have other effects on your health that you're not trying to achieve, right? So that's the reason that so much nutrition information is eggs are good, eggs are bad. Well, what am I supposed to do, right? So it gets really confusing. And so that's why having a personalized health coach can be really helpful, because we are working to say what's best for you, not everybody else, right? And so that's where it can get really, really helpful. Yeah.
So let's say people that have high cholesterol probably should get away from fat. But let's move on.
That's not true.
Okay, all right. That is.
Yeah, I could talk all day.
That's a whole nother presentation.
Chicken broth, bone broth that you think is better than others.
That tastes better?
Bone broth.
Bone broth, it tastes better? Is that what you're asking?
Yeah, or recommended, or people like it. Do you have any?
It's a lot of personal preference. I
Yeah.
know some people really
So
like,
I personally have osteoporosis.
Mhm.
So bone growth would be good,
Yeah,
okay? It depends where we are.
correct.
Now, what about the peptide and collagen powders? Do you know much about it?
Not specifically today, but again, I mean, there's gonna be a million questions that come up. And so we'll kind of keep going through the presentation. We'll make some extra time for questions at the end, so. Keep going. Yeah, you're up.
Yeah, so I think it's really interesting, when we think about secondary food, what we're putting into our bodies, we know that that impacts our physical health, right? It can, it affects our blood pressure, our blood sugar levels. There's this really well-researched and well-known link between what we eat and how it impacts our physical health. But what we eat, what we put in our mouths is just as important to our mental well-being. And I really didn't know that until I started doing some of my own research on it. And so that's what I'm here to talk about, is how our secondary food really impacts our mental well-being as well as our physical health. It's just as important to it. So raise your hand if you've heard of the standard American diet or the SAD diet.
Very sad.
Yeah. And so when we think about the standard American diet, a lot of times that is, a diet that is comprised mostly of processed foods, right? Processed meats, refined carbohydrates, so foods that are really high in sugar, fried foods, fast food. And what we have discovered is that for people whose diets largely resemble a SAD diet, right, that standard American diet, there are higher levels of anxiety and depression among those folks. So research is showing us, right, what we eat is important to our physical health, but it's just as important to our mental health as well. And so the reason for that is because food breaks down to make up our neurotransmitters in our brain. Right. So an example, there's many of them, but I chose a couple. Well, I chose one. So turkey is a source of protein, right? And when it's metabolized, it breaks down into this thing called tryptophan. And tryptophan is what builds serotonin in our brains. And serotonin is a neurotransmitter that helps us regulate our mood. So feel good. It helps us feel joy throughout our day. It also helps regulate our sleep cycle. And so what happens is if we're not eating a well-balanced diet, we're not getting those nutrients that are needed to make neurotransmitters in our brain. And then we can see changes in our mood, changes in our energy level, right? We might feel unmotivated. We might feel really fatigued throughout the day. So nutritional deficiencies, if we're not eating a well-rounded diet, if we're not getting the essential nutrients we need, impacts our mental well-being as well. So just something to keep in mind, right? We know it impacts our physical health. It's also very impactful on our mental well-being. And of course, there are other things that contribute to mental health challenges, right? There's environmental factors, there's a genetic component, but diet is one piece of that puzzle. And it's something that we can make changes to at any stage of life, and it can still have a really positive benefit. I think I have, oops. One other thing, sorry, going back a slide. I wanted to speak to vegetables as well. So I know Lily's, talked about eating the rainbow and not Skittles, right? Eating the rainbow of vegetables because vegetables are filled with so many important nutrients and antioxidants, like Lily was saying. And they're a great source specifically of B vitamins. And so I wanted to throw that in there. B vitamins, when we are deficient in B vitamins, we notice that we're more irritable. We're more fatigued throughout the day. We have higher levels of anxiety and lower moods. And so that's just another example, just like the protein example, of how our diet really does impact our mental health as well. And so like Dr. Cowie and Lilly said, there are lots of recommendations, right? Eat eggs, don't eat eggs, follow a Mediterranean diet, no, do keto, right? I think what I love, my one-liner takeaway, this comes from Michael Pollan. He's a journalist and a researcher. He said, eat real food, right? So not the standard American diet that's processed and refined. Eat real food, not too much, right? Listen to our bodies, not trying to overeat, and mostly vegetables. That was his recommendation. So he breaks it down to be pretty easy. So I'll let Dr. Cowie talk more. Yeah.
Yeah, and I have a question. When you say eat the rainbow, You're talking more about vegetables and not the fruits?
Both. Yeah, both.
Eating fruits as well?
Absolutely. Yeah.
Okay.
Yeah.
All
Fruits and vegetables. I love vegetables. And so I just wanted to throw in there, eat your veggies, right? But yeah, and like Lily was saying, as much color as you can incorporate. Yeah.
It's a good question though, and Joanne's question for those on Zoom was, what about fruits, basically? And again, it kind of comes down to, it depends. Like if you're a diabetic, we wouldn't necessarily recommend you eat a lot of fruits. We might recommend specific kinds of fruits and in smaller quantities, right? So again, personalized, what works best for me may be terrible for you and vice versa. So that's why when you hear these overgeneralizations of something, which I'm about to do, it may not necessarily be the best for you personally. So with that caveat, we're going to talk a little bit about supplements. So I kind of anticipated might have some questions around these. So for folks over 65, if a lot of questions I get as a family physician are, and I have a lot of patients who will come in and they're taking a list of supplements this big, right? And I'll say, well, what's that for? They're like, well, I read a magazine article somewhere and it said it was good for me. And I'm like, but for what? Like, you know, and so it's really important if we're taking anything that we know what it's doing to our bodies. And that applies to our foods too. So if I'm eating this, I should understand what this is doing in my body. It's the same with a pill. You wouldn't just take a pill from your doctor if you had no idea what it was for, right? Here, take this. I'm not gonna take that. I don't know what it's for, right? But we do that with supplements. Sounds like a great idea, okay? And foods. Yeah, sure, why not? You know, like, so we need to kind of think about, why are we putting this in our body, and really what benefit or harm is it causing me, right? So if you want to say, like, what are the big, like, 6 that are worth my time and worth my money over 65, just generally speaking, it would be these ones. So I'm going to kind of go on these a little bit. Okay, so omega-3s, everybody talks about these. Our SAD diet is really high in what are called omega-6s. And so doing the whole opposite of that antioxidant thing, they're oxidizing. And so omega-3s, what they are polyunsaturated fatty acids. And so there's kind of conflicting studies on what the benefits are. But when we look at this as a whole, it looks like consuming fish, oily fish, and we're talking like primarily things like salmon, may be better as far as our ability to absorb it. However, there are some other studies that show that there's a dose dependent effect, anti-inflammatory effect. So how many of you in this room have any achy joints? Right? Yeah, me too. Okay, so there is some pretty good data out there that higher doses of omega-3s, and we're talking like 3 to 4 grams per day, have an anti-inflammatory effect that may help things like arthritis or autoimmune conditions. And the detriment of taking too much omega-3s is you can kind of get like burpy, gassy kind of stuff. So your body will kind of tell you when to cool it, okay? And the other is that it depends if you would want to run this by your doctor too, if you had any reason why you shouldn't take something that would potentially cause you to bleed more for any reason. So those are some things to think about. The thing about omega-3s, like we push these in pregnancy because it looks like after 20 weeks of gestation, it helps our babies be smarter, maybe. But it may help with brain function also later in life. So there's some studies that show that it may help kind of stave off things like Alzheimer's, like who doesn't want that? So again, if you're going, I need to just pick 6. One, I would say eat more fish. Okay, if I'm just not going to do that, or I just hate fish, doing a supplement in this area might be a benefit. All right, vitamin D and calcium. Hopefully everyone's heard about this. Okay, so vitamin D over the last, let's say 10 years. So I've been in medical practice probably longer than it looks like, but when I started out, like vitamin D was this like really sexy vitamin. Like everybody wanted to check it and everyone should take it. And if you take it, you're going to live forever and everything's wonderful. But we know that that's not necessarily the case. Initial studies show that it may decrease risk for falls, to the point that the United States Preventative Task Force actually recommended it for seniors. And now we found that that's just not true. Okay, so, and they said, so they yanked that recommendation away. But because the study that was originally done was using 400 international units, that's how we measure vitamin D, okay, per day. If you look at supplements, if you go and buy a vitamin, does anyone want to volunteer if they're taking vitamin D? I am, okay. Do you know how much vitamin D you're taking? No, no idea. You should know what you're putting in your body, right? So this is your homework when you get home, right?
No, I take it, I look what I should, and I'm taking it.
Okay, like this is what they told me to do, so I'm doing that. Okay, so 400 international units a day, what was done in these original studies. And it was around like prevention of osteoporosis and falls, particularly around hip fracture. Because we know if we break our hip, bad things happen, we want to prevent that, right? And so what we found is that levels over 400 international units a day may have additional benefit, okay? At this altitude, doing my own little trial on my own, checking all of my pregnant patients for vitamin D, literally 96% of them were low in vitamin D. These are young, healthy females, okay? And so when I'm talking other folks, if you're not getting outside like half clothed, you're not absorbing that level of vitamin D from the sun. We also don't want to do that at this altitude because of our risk for skin cancer. So it becomes a really tough thing. So we get vitamin D and calcium primarily from dairy products. And so for those of us, because we don't live near a dairy farm here, we typically don't consume large amounts of dairy. Over 65, many of us can't tolerate dairy anyways. And so this would be one, again, top 3, if you're going to take a supplement, would be one that I would recommend. But I would recommend at least 1,000 to 2,000 IUs per day. The
Calcium, 1,000.
vitamin D, 1,000 to 2,000. Just to give you a little context, we recommend 2,000 IUs per day for pregnant women. It gives you an idea of like safety factor wise. Okay, so I'm sorry,
Vitamin D is calcium.
just vitamin D I'm talking for right now. Okay,
So 400, it says 400 up there, but you're talking.
so no benefit less than 400. So the original studies that showed like decreased risk for fracture was using that 400. That was the original recommendation. And then they were like, yeah, nope, that doesn't work. But they're looking like there's benefit above 400. So if you look at a lot of combos, if you get a vitamin D calcium combination, will often come with 600 milligrams of calcium, 400 IUs of vitamin D, 200, and then you take it twice a day. What I'm saying is that's not enough. If you're going to take vitamin D and you want to make it worth your while, you want to take more than that, between 1,000 and 2,000 a day. Be careful though, if you're taking a multivitamin, it probably is in there too, especially if you're taking one for women. You want to make sure it's adding up, it's not surpassing 5,000 IUs per day. Okay. All right, calcium. So calcium is super confusing right now. Okay, so we know calcium is important for our bone health. We don't have enough calcium. Calcium is one of the building blocks for our bones, right? We lose bone density as we age. That happens. So for postmenopausal women, it's still recommended to take 1,200 milligrams per day. Again, that combo comes with the 600, typically take 2 a day. Some research suggesting that increased levels of intake of calcium increase our risk for coronary artery disease. That's bad, right? Okay, so it's kind of like, do you want a heart attack or a hip fracture? Which one should I choose, right? Okay, so we have to kind of take all those things into consideration. Like if I have done a coronary calcium score, or I have 0 family history of heart disease, I have no high blood pressure, none of that, but I have osteoporosis, it's probably better for me to take calcium, right? Okay, if I have both of those things, well, we should talk to my doctor and figure out what I should do, right? And we have a conversation. So it's not going to be a blanket recommendation for everybody. So food sources, when we're talking about calcium, this is one I'm really passionate about, is that this is better to eat your calcium than to take it, okay? Some of us just can't absorb it well. So this is why you find calcium compounded with a whole bunch of different salts. You'll see like calcium oxalate, calcium, magnesium, calcium, and you're like, well, which one do I do? If you ask the natural food store, they'll tell you one thing. You go down to Whole Foods, they'll tell you something else. You go to the pharmacy, they'll tell you something else. Okay, so it gets really confusing. What we do know is we absorb calcium from our food. That's what it's designed to do. So the way that we get that, dairy products, you can get ones without lactose if you can't absorb them. Okay, canned fish with soft bones. I mean, that's not my favorite, but you can. Okay, dark leafy greens like kale, that's a really great one. Okay, so looking for food sources for calcium, really important. All right, I'm gonna keep going. So B vitamins. So Kristen touched on B vitamins. We're talking about so important for our mental health. Vitamin B12 is one that gets a lot of press too, because you can like walk down the street to like, what's it called, and get an IV infusion with some B12 and walk out of there and feel amazing. Okay. The problem with that is that it's not long lasting. B12 is a vitamin that as long as your kidney function is fine, you can't really overdo it because you just pee it out. So a lot of my patients taking all these vitamins, and I always say they're making really expensive pee, okay? It will also make your pee really yellow. So if you take a lot of vitamin B12, it'll do that. So vitamin B12 is super important for our nerve cells like Kristen was talking about, and also our blood cells. So some people can't absorb vitamin B12. Vitamin B12 is one of the vitamins that's not absorbed in our upper GI tract. It's in our lower, it's in our lower intestine, basically, the first part of lower intestine. So it needs the stomach acid, needs this really acidic pH environment to be able to be absorbed. So if you have issues with stomach acid, what do we do as doctors? You come in, I got reflux. What do we give you? Pepsid, right? Yeah, Tums, all those things, right? We lower the pH of your stomach, okay? You feel better, right? Because then you're not getting it all coming up your neck, right? But then what happens is that we can't absorb that B12. Other medicines like metformin, which is our go-to medication for diabetes or pre-diabetes, also interferes with B12 absorption. And so if you're on a PPI like omeprazole, Prilosec, Protonix, any of those kind of medications, or metformin, you ask for a B12 level, okay? That is one that we can measure in your blood and is a good idea to measure, okay? Most people can absorb enough B12 even if they're taking these medications orally, if we give you a high enough dose, okay? Or you can do over the counter. You'd want to talk with your doctor about what dose would be right for you. It's definitely individualized, which is why I'm not going to give you this is how much. Some people can't absorb it enough, okay? Because they either on a medication, because they have a problem, it's called pernicious anemia, basically they cannot absorb that vitamin. And so in those cases, they need to get a shot of B12. So you hear people getting B12 shots, and you get people B12 shots and they walk on there, I feel amazing, okay? Like, but which is always cracks me up because it takes 3 months to make a red blood cell, and that's what like increases our oxygen carrying capacity. So like that they're walking out of there feeling amazing is great, but it's not from the B12 shot, okay? So 3 months later, if they're like, I feel so much better, then I'd be like, okay, well, that makes sense. But food sources of B12 are primarily things like organ meats, beef, salmon, clams, Fortified yeast is a really great way to get B12, and one that I recommend to patients and clients. You can get it in a shaker bottle. It actually has a pretty decent taste to it, kind of like a Parmesan. Like we put like broccoli in the oven and then we shake it on top of it, and my kids will eat it and they don't even know they're getting additional B12. So eggs are also a really great source of B12. So B6 is also a really important vitamin. It also helps protect nerves and form red blood cells. This is one we get mostly from food sources too, potatoes, bananas, chicken. This is the one that I would say, when I keep pointing to Kristen, when we're talking about mental health things, it can be really helpful as far as anxiety goes. We use it also for nausea. So this is one that's prescribed to like pregnant women for pregnancy-induced nausea, because one, it's safe. Again, if you have too much of it, you pee it out. So it's not dangerous. So we use that one a lot. So these ones, often you can get what's called a B complex, and it will have B12, B6, and B3 in it. Okay, so this one's pretty interesting. It's called acetyl L-carnitine, or in other places you'll just see L-carnitine or Alcar. So this one's kind of interesting. And what it actually does, and when you kind of look back, kind of the building blocks for mitochondrial functioning. So mitochondria is part of our cell, okay? And it's really important in a lot of our cell function, okay? And so what this does, it's a building block to allow those mitochondria, which help with that oxidative stress, okay, to do what they're designed to do. The mitochondria are kind of like a power cell of the powerhouse of your cells in a sense. And so by feeding your mitochondria, you can improve that age-related fatigue and cognitive decline that nobody likes or wants. And it's pretty safe. And so if I have patients come in and saying, I'm taking this, this, and this, and acetyl L-carnitine, I say, great. So this is from the NIH Office of Dietary Supplements. And in the study, it actually shows a mild improvement in cognitive impairment with Alzheimer's disease and in patients what's called a diagnosis of mild cognitive impairment at 1.5 to 3 grams per day. Again, it's better to eat your vitamins than pop your vitamins, okay? And so food sources are primarily meat, poultry, fish, and dairy products. So you can see a lot of these things come from meat and dairy products. And so if you are a vegan or vegetarian, it's definitely something that you need to pay special attention to make sure you're getting all these things in your diet. So now what?
So who knew all of this information?
Oh, yeah, we all.
Fantastic. So health coaches are really important if you're looking for a job. No, just kidding. So this can be really overwhelming with a lot of information. And this is just a little touch of what health coaching does. You know, in private health coaching sessions, we have a lot more of a relationship, a conversation. So it's not as much information thrown at you in one time. So the really cool thing is, you know, if you are a patient at the care clinic, this is a free service that we offer there. Anyone who is interested can ask to be set up with a health coach, and we'll make that happen. And you can have as many sessions as you want, as few sessions as you want, just kind of touching on more of this information to really meet what your goals are. You know, if you're not a patient, health coaching is growing, and I know there are some opportunities in the community to be able to search out health coaches as well, if this is something you kind of want to explore a little bit more. I would love to kind of have, what do we have, a couple more minutes? A time to be able to ask all of us questions, if you have any. So let's open kind of the floor to questions. Yes.
What about grains? Spring bread, gluten, wheat, all that stuff. It is an easy
Yeah,
But it's probably like all these.
grains, bread, gluten. Do you want me to take that one? You want to say, sure, go for it. All right, so can I ask you questions back? Okay, so do you have any diabetes or history of insulin resistance or anything like that? No. Do you have any other history of food intolerances?
Well, I do the blood work, I need to do something, find out what I'm sensitive to. I don't want to know allergies,
Uh-huh,
but I've got sensitivities.
sensitivities.
Like beans, and, it'll come back the same.
So you've done one of those kind of blood tests that, okay,
concept.
okay. So,
And we ends up on
and wheat ends up on them all the time.
beans, we couple of
Beets and, okay,
things.
so got it. All right. So there's not a great blanket answer for that, because that's why I'm asking, can I ask you questions back? Because if you have a sensitivity to wheat, then we're going to work around that and try and avoid it. Okay. And then we would get into why. And so the short answer is that if you have a sensitivity to one of those foods, it causes inflammatory reaction in your body, which manifests completely different in every person. And so for you, it would be better to avoid it, right? So across the board though, it depends on our ancestry, our blood type, our genetic makeup, how we feel when we eat these foods. If we're a competitive athlete, what's our activity level? There's so many things. So to say, yes, it's bad, or no, it's good, is kind of impossible. But what I can say is, for a vast majority of people in the United States specifically, most of us have a genetic makeup that is not favorable towards gluten. So,
I do gluten free because I know what I eat,
uh-huh.
but I don't know what else is in the other gluten free.
Yeah. So the thing about it, a lot of things that are substitutes for gluten are made with rice flour, tapioca flour, cassava flour. There's those kind of things, which often have a higher glycemic index than even wheat. Yes. So then we have to pay attention. Do we have any risk for diabetes? What's our BMI? All of those things too. So, yeah. Yes.
And a blood test, I know you get your levels of vitamin D tested, it gives you a number, but
Yes.
what about the B vitamins?
B vitamin.
When you get a blood test, does that show up if you are in a range of below or normal, or?
If you ask for it, you can get I would say if you came in and were like, I want to get all my vitamins checked, I'd be like, so, and then my question back to you is, what are you trying to know, right? And so if you want to know like your vitamin B12, that would be a good one to have checked. And yes, it can give you a range. But if you came in and want to say, I want to have all of these levels checked, again, I get back to what are you trying to know and what are you trying to accomplish?
Because I've heard, like a vegan,
Mhm.
or vegetarian.
Yeah.
Then they're not getting the.
So in
So how do you
strict
know
vegans,
what
we
you're-
check their vitamin B12 level regularly.
Okay,
Yeah.
So you can check it.
B12 is one you can check, yes. Yeah.
These specific supplements that you talked about, and whether I should take them or not, what about a multivitamin?
Mhm.
A lot of, and then on the shelves, there's multiple vitamins for, over 65.
Yeah,
Men over 65,
Yeah.
women over 65.
Yeah.
They have all these subcategories.
right.
What's your reaction to that?
How do
versus-
I know, right? Yeah, what would happen if you took your wife's vitamin? What would happen? I'm kidding with you. So the thing about it is, if you ever you took the time and like actually see what's in the multivitamin side by side, it's a great idea to take a multivitamin if one, you're unable to eat a balanced diet for whichever reason, right? Or two, you have a really restricted diet because of health reasons or something like that, okay? or you don't have the potential income or means to be able to get certain types of foods. So a multivitamin is really important in those cases. For the vast majority of people who have access to really great foods, a multivitamin is probably not necessary. So.
I hear that,
Mhm.
and I've heard that before.
Yes.
But who eats a healthy diet? You know, the NIH or some people, they say, supposed to have 4 or 5 vegetables a day and 4 or 5 fruits a day.
Mhm.
I don't eat 5 vegetables a day. I might eat 3, but I don't eat 5.
Yeah, so then maybe a multivitamin would be a good idea for you, or supplementing with some of these things, or talking to a health coach to try to figure out what you're supposed to do. So there's a lot of play with it. So, and it depends if whose guidelines you're looking at too. So. Yeah. We can give out contact information, yeah, for sure.
Did we bring some of those flyers?